pathological features and clinical course in patients with recurrent or malignant orbital solitary fibrous tumor, Hemangiopericytoma. By Sagiv, Oded, Bell, Diana, Go, Yunxia, Sue, Shirley, Wester, Sara T, Jiang, Kailun, Yin, Vivian T, Shinder, Roman, Hayek, Brent, Kim, Joon, Tetzlaff, Michael T, Esmaeli, Bita via Ophthalmic Plastic and Reconstructive Surgery, published ahead of print. Purpose: a risk assessment score for metastasis based on age, tumor size, and mitotic figures has been suggested for non-orbital solitary fibrous tumor, SFT/Hemangiopericytoma. The authors herein examine the clinicopathological features of recurrent and metastatic orbital SFT and evaluate the existing risk assessment score for orbital SFT. Methods: the American Society of Ophthalmic Plastic and Reconstructive Surgery Oncology database was queried for patients with recurrent or malignant orbital hemangiopericytoma, SFT. The medical records were reviewed for clinical and pathologic findings, treatments, and outcomes. Results: 8 patients from 3 institutions were identified with recurrent orbital hemangiopericytoma, SFT. Median age at diagnosis was 59 years, and 4 patients were women. The mean size of tumor was 2.1 ± 1.1 centimeters. All patients were initially treated with surgery and experienced local recurrence after a median of 4, range 0.5 to 10, years. 5 patients were treated with orbital radiation. 2 patients also developed distant metastases and eventually died of their disease. Median Ki67 was 5%, range 1 to 65%, and 5 mitotic figures/10 high power fields, range 2 to 30. The previously described risk stratification model for non-orbital SFT did not correlate with the propensity to develop metastases in this cohort. However, both patients with distant metastasis had 4 mitotic figures/10 high power fields. Conclusions: in this cohort of recurrent orbital hemangiopericytoma, SFT, median time to recurrence was 4 years, underscoring the importance of careful continued follow-up. The current risk stratification models have limited use for orbital lesions, mostly due to the fact that orbital SFTs are smaller than even the smallest size criteria in this risk assessment model. Accepted for publication June 17, 2018. This work was supported in part by the American Society of Ophthalmic Plastic and Reconstructive Surgery, ASIPRES, Foundation through their support of the ASIPRES Oncology database at MD Anderson Cancer Center. The authors have no conflicts of interest to disclose. Presented at the American Society of Oculoplastic and Reconstructive Surgery Fall Meeting on November 10, 2017 in New Orleans, Louisiana. Address: correspondence and reprint requests to Bita Esmaeli, MD, FACS, Orbital Oncology and Ophthalmic Plastic Surgery, Department of Plastic Surgery, Unit 1488, The University of Texas MD Anderson Cancer Center, 1515 Holcomb Boulevard, Houston, Texas 77030. Email: bismaeli@denterson.org. Copyright 2018 by the American Society of Ophthalmic Plastic and Reconstructive Surgery Incorporated, all rights reserved. Add tags: currently, #aesthetics, medicine by Alexandros G. Sfakianakis,